7 Action News reporter Faraz Javed gives us a closer look at the current impact of COVID-19 and cautious optimism of health experts.
Doctors here at Ascension Hospital say even though the worst of the Omicron surge is behind us for now, people should still exercise caution.
We have more patients that we find they get hospitalized for something else and then are incidentally found to have COVID positive tests.
As COVID-19 positivity rate drops in Michigan, Dr. Steve McGraw says the situation in the emergency room is finally changing. For instance, patients don't have to wait for hours to be seen, nor are patients being treated in the waiting room like they did during the peak of the pandemic.
We had to adapt to make certain that we got people the care they needed in whatever fashion we could achieve it. I would argue that we're already back to the 90% seeing a provider within 30 minutes of arrival.
Dr. Nahid Elias says telemedicine played a key role in reaching patients faster and keeping the less critical out of the ER.
Now we can use it every day for patients, even they cannot come to the office, elderly people, they don't have transportation.
Telemedicine also played a critical role in this week's snowstorm. Dr. Elias recalled assisting a patient who traditionally would have avoided driving to a hospital due to the storm and as a result would have suffered.
I could see the rash and characterize the rash, and it is a shingle. So right away we give him the medication, the management for the shingles.
Besides COVID, the winter season also brings other ailments. Doctors say the usual suspects are bacterial infections, strep throat, viral pharyngitis, and then thanks to the snow, there are also cardiac events, hypothermia and frostbites, among others. But interestingly, cases of flu have been the lowest 2 winters in a row. Dr. McGraw says it's most likely due to people getting their flu shots and also practicing COVID safety measures.
This is a good lesson going forward. Maybe in bad flu seasons, we emphasize both, getting our vaccines every fall, but also making certain that we learn some about the things that COVID has taught us about not being within close proximity of people, staying home when we're sick.
Now, when visiting an emergency room, Dr. McGraw says to highlight your severe symptoms, especially the ones you're experiencing for the first time. This will allow the team to treat you accordingly. Reporting in Southfield, I'm Faraz Javed, 7 Action News.